So good morning, everyone. I'll take the next few minutes to talk a little bit about the Phacodynamics. I know this is a very vast topic, so I'll try to do justice to the limited time that we have. So basically, when you're doing a Phaco, there are 4 or 5 things that we need to take care of, and Phacodynamics is basically balancing all these things with the fluidics and the Phaco energy that we use. The first thing is the bottle and the height at which this bottle of fluid is kept. Second is the irrigation line. The third is the Phaco machine, and the third is the Phaco hand tip, and also the handpiece and the Phaco tip. The fourth is the aspiration, which goes hand in hand with the irrigation. And 5, of course, is the pump and the Phaco machine that we use. So interplay of all these factors is what enables you to do good Phaco and to prevent any damage to the endothelium and to have protection to the anterior chamber structures. So the bottle height itself decides the inflow. Obviously, most of the systems nowadays are not gravity-based, and the newer systems actually calculate the intraocular pressure and able to measure it in the anterior chamber itself in the handpiece and also in the Phaco cassette. But most of the older grade systems are gravity-based, and therefore you have to adjust the bottle height yourself, and that bears a very important role in how the AC is. So the AC is more stable and there is less chance of collapse when there is more flow. So when there is more flow, as the volume of the eye is stable, as you can imagine, the pressure would increase when more flow goes into the eye. Therefore, there is more pressure, the AC is more stable, but it is less chance of collapsing. And the irrigation and aspiration lines, as we all know, the irrigation line has to be thin. And this is because you want a free flow of fluid to come into the eye. But the aspiration line has to be thick. And the reason this is so is because we don't want the tubing to collapse when we're doing the aspiration. And this actually is to increase the stability of the anterior chamber and to reduce the the Phaco surge. So there has to be some resistance to collapsing, and this is why the tubing is thicker, and also the bore, as you can see, is a little smaller in this case, to allow further resistance to take place in the anterior chamber to be maintained better. So the Phaco tip is very important. A lot of research has been done into it. And if you get a tip like this with 0 degrees, you'll have a better holding, as you can imagine. The holding of the tip will be better. And if you have a very extremely angle like this, 60 degrees, you'll have a better cutting power. So somewhere in the middle, a compromise between these two, around 30 degrees, will be a good compromise to have holding and cutting power. The Phaco tips these days, again, are very efficient. The newer one, and this particular, the ones that I'm talking about are the Alcon ones. Of course, each company has their own latest iteration. The Johnson & Johnson ellipse tip is also extremely good. This, of course, is the Alcon tip. This particular one, in the previous iteration, you can see here the Kelvin tip, there was a slight angulation there, and therefore the manipulation inside the eye is slightly different. So each tip has its own angulation and all that. And so it takes a little bit of time. If you're using a different tip in different machines, you have to be a little bit careful and be conscious of the fact that they will work a little differently. So it is all about dexterity of the hand and how you manipulate the. So next is what Dr. Tony was saying about the continuous, the pulse, and the burst mode. So the continuous mode is basically when Phaco energy, as soon as you press the pedal, Phaco energy goes to 100%. Of course, that also you can make it linear to start at 0 or 10 or 20 and then go up to 100. But basically the Phaco energy is continuous. Whereas in pulse and burst modes, there are intermittent places where the Phaco energy is not delivered. And this is basically to increase the efficiency and reduce the Phaco power being, overall Phaco power being introduced into the eye to prevent corneal endothelial worsening. So as you press the foot pedal, the Phaco power goes up in the pulse mode. Whereas in the burst mode, you see the energy is maximum, but the bursts they are given as the bursts of energy, and the frequency of the energy increases as you press the foot pedal. So that everything put together, what you're effectively trying to do is to reduce the cumulative dissipated energy, but don't go only by this. You should also go by how safe the corneal endothelium is postoperatively, how safe you are in preventing, touching the iris and going near the posterior capsule and all that. But this gives you some reference as to how much of Phaco energy you've used. So now with the advent of these torsional and elliptical Phaco, the efficiency inside the eye is increased dramatically. Not much of issue as far as Phaco burns and all happens with these. And so even if you use continuous Phaco in these modes, they are quite okay most of the time. A little bit about the pump. So actually the Phaco energy works on basically either the peristaltic pump or the Venturi pump. So the peristaltic pump works on this method in which actually all you're modulating is the aspiration flow rate or how fast this particular roller ball works. Whereas the Venturi pump is basically an air pump that sucks and causes a direct vacuum. So basically, I'll just take 30 seconds. So basically the difference is the peristaltic pump, you actually modulate the AFR or the aspiration flow rate, and that actually increases the followability, which means the nucleus bit coming towards the tip. Once the nucleus comes to the tip and is fully occluded, then the vacuum setting can be modulated and increased based on that. Whereas the Venturi pump system is more intuitive. If you increase the vacuum directly, it means the nucleus will come towards the tip. So in that way, it's more intuitive, but it is a little bit more risky in the sense that you have to be careful not to touch the adjacent tissues and cause harm to the iris, etc. So each machine has its own sort of this things, a lot of. So in the settings, basically, in the pre-phaco settings, mind you, this is a peristaltic machine that I'm using here, the Alcon machine. So in this, the vacuum has to be pretty low and the AFR also moderate at about 25. And you don't need much phaco energy because you're removing only the topical cortex and epinucleus. During the trenching phase, you need a lot more power. You're not moving the phaco, you don't want to move the nucleus at all. You just want to trench smoothly without manipulating the nucleus. So phaco power maximum, vacuum and AFR moderate. During chopping and emulsification, you need much more AFR and vacuum, and the phaco power can be moderate to increased based on what the density of the nucleus is. In the epinucleus, the vacuum will be moderate, AFR will be a little bit on 30 to 35, and the phaco power also will be minimum. The cortex aspiration and the viscoaspiration stage, you need a high vacuum in the AFR to maintain the anterior chamber as you are aspirating heavily. Same with the viscoaspiration. To remove the last step in front of the front and behind the IOL, you want to remove that. So, all right, thank you.